Thank you, Ciarán Corla. I'm going to read into the record both representations made. So, dear Verona, you will be aware from previous correspondence that I am a full-time family carer to my sons Evan, 21, who is non-verbal and has diagnosis of ASD, ID, ADHD, keratoconus and complex medical needs, and Daniel, 17, who has a diagnosis of ASD. Like so many family carers across Wexford and the entire county, COVID and the necessary restrictions imposed during lockdowns was a challenging time for families like mine. The challenge was no greater than when adult disability day services and special needs schools closed. The small amount of home support we had came to a sudden halt, and our doors were closed behind us, leaving us caring alone, often with loved ones who did not have the capacity to understand COVID and suffered greatly from the absence of their much-needed routines. Family carers played a vital role in protecting our most vulnerable citizens and in suppressing the virus by caring for our loved ones in their own homes while keeping them safe as well at an enormous personal sacrifice, as there was no end to our shifts, there was no days off, and for many of us there was rarely a night's sleep. I'm writing to you to bring to your attention the many difficulties I am currently experiencing in securing essential medical appointments for my son Evan. Evan has multiple profound disability, and the pandemic, particularly the changes it brought to his life, had a profound impact on him in terms of consistent disruptive sleep, serious hypertension and an increased obsession with food. In consultation with psychiatry, primary care, HSE, disability services and Wexford General Hospital, Evan was referred for urgent review to Dublin Hospital for assessment of a possible additional diagnosis. His symptoms are persistent, and I am therefore anxious for him to be assessed as a matter of urgency, as it is also the medical advice. Following the cyber attack experienced by the HSE, I was unable to make any contact with the hospital department to which Evan was referred. Having left multiple voice messages detailing my concern, my calls were not returned. Evan also has a degenerative eye condition which has seriously impaired his vision, and in the absence of care could result with further loss of vision. The medical advice is that Evan's vision is to be reviewed every 6 months to monitor any changes to his condition, and as Evan is non-verbal, he is unable to tell us if he is experiencing further sight loss, making it imperative that he is reviewed on a 6-monthly basis. Evan received his vaccine. As soon as he was vaccinated, I requested an appointment for him. The appointment was offered for the week in which the cyber attack took place. Then I received a phone call to say it had been cancelled. I attempted to contact the department. The voicemail box was full and no longer recording messages. There is no available email address in which to contact the office, so I called the hospital switch, where I was put through to an alternative extension and advised that the secretary responsible for Evan's appointments was on leave and that there was no information with regard to when she might return. No solutions offered as to how I might resolve the issue in the interim to provide Evan with the care he needs. It is not acceptable, in my view, to compromise the health and well-being of our most vulnerable citizens by making it next to impossible to communicate with hospital outpatient departments. I'll move on to my next representation. Peter is non-verbal and has a number of complex medical issues. He attends St Vincent's Hospital for regular checkups. Peter presented at the Primary Health Care Centre in Grogan's Road, Wexford, as an emergency with his mother last week, as he was experiencing difficulty with an abscess on his gums. It was determined by the dentist on the day that Peter was in need of an extraction and further treatment, but his mother was informed that they would have to wait for 3 years. Peter has obviously previously visited the dental clinic in Grogan's Road a number of years ago with his mother, and he was told he would be in receipt of the following treatment via an appointment. The appointment never came, and to the best of my memory, the visit was perhaps 3 or 4 years ago, but she could not recall the exact date.
Deputy.
Thank you, Ciarán Corla, and the Minister, as you put it, as the question as you put it to the Minister. Thank you.
Thank you. Minister McConalogue.
Thank you, Deputy Murphy, for your topical issue today. And Minister Rabbitte has asked me to take it, as she couldn't be here herself, and I was glad to do so. And I know that the topic you have down today in particular refers to addressing the 3-year wait time for disability dental services across County Wexford. I know you've raised specific cases there in your contribution. I certainly will make those and relay those directly to Minister Rabbitte in relation to the experience that you've had. In relation to the overall issue in question, Deputy, with regard to the waiting times for dental services and other difficulties that family carers are currently experiencing in securing essential medical appointments for people with disability in County Wexford. I want to update you that, first of all, dental services for children up to 16 years of age and persons of all ages with special needs, including patients with disability, are provided by public dental service of the HSE through its dental clinics, and emergency care is also available on a daily basis. Previous surveys and research in Ireland show that dental care for many people with a disability can be provided in primary care and community settings by a dental workforce with relevant skills and competencies. There are waiting lists for those for whom provision of care requires the use of either sedation or dental general anaesthesia. This treatment requires special facilities and staff with specific expertise. Furthermore, treatment under general anaesthesia requires hospitalisation. Treatment in hospital requires a referral from a primary care dentist, and the HSE dental service and acute hospitals collaborate in this regard. In line with other services, dental treatment, including treatment under general anaesthetic, has been curtailed during the pandemic, and when provided has been at a reduced capacity. There is some capacity for dental surgery at Wexford General Hospital on Friday mornings, and this is mostly used for paediatric dental extractions, but when possible can be utilised for disability services clients. The HSE anticipates that the filling of vacancies of one full-time in special needs and one part-time in public dental services in Wexford after the gradual resumption of services phased down during COVID-19 will help to reduce the waiting lists during 2021. Minister Rabbitte has been informed by the HSE that most community health services, such as disability services, are operating as normal. The HSE's advice for families is to attend any appointments scheduled with disability services. If there is any change of a scheduled appointment, local HSE services will contact families directly, and families can see the latest position as well on the HSE website. Minister Rabbitte has said that she would like to stress the importance of mainstreaming. People with disabilities, like us all, just want to live normal lives in normal places as much as possible. And it is an obligation upon all of us to ensure that the needs of people with disabilities are understood and vindicated in every policy. People with disabilities should have the same access to health care as everybody else in our society, and their needs should be factored in as we design and deliver our health services to provide the best outcomes for all the people of this country. Smile agus Sláinte, the National Oral Health Policy published in 2019, provides a new framework for the delivery of oral health services. The ethos of the policy is to maximise the services available in primary oral health care settings, with care provided by local family dentists and their teams. This means that children, adults and vulnerable people, including people with a disability, will all be able to access oral health care in the local dentist practice of the individual's choosing. To support the mainstreaming ethos, additional support, technology and time required to treat more vulnerable patients will be provided by the salaried service of the HSE. And the HSE service will also have a role in assessing the oral health status and the oral health needs of vulnerable people, in particular those in residential care.
Thank you, Minister. Deputy Murphy.
Orla, and no disrespect to the Minister, thank you for coming in to answer my topical, but the reality is here, we all in this House have to work towards something that's better. Nothing you've said, Minister, fills me with hope, and it most certainly won't fill those I'm representing with hope. It's unacceptable for someone with complex medical needs, non-verbal, to be taken in on an emergency appointment basis to be told that the waiting list is 3 years. Count Corla, there's nothing improving in this regard, and I appreciate everything the Minister has had to say, but it's being said for a long time. Nothing's improving. Absolutely nothing. These people that I'm representing today are only 2, but I have about 42 that I could read into the record, and I'm becoming very disillusioned that we are leaving vulnerable adults, vulnerable young children with very complicated medical needs just at the end of the queue because they are in the minority and they are marginalised. And I appreciate Minister Rabbitte is doing her best, and I know that because we communicate regularly, but something we've got to start to walk the walk and not just talk the talk. If I was to take a non-verbal child into an emergency scenario appointment like this and to walk out with the only answer being that you can wait for another 3 years, I just don't know mentally how I would cope with that. I don't know mentally how their carers and their parents cope with that. To see them in pain, unable to express it, and they just seem to get the same answers all the time. That's primarily why I'm here with the topical. I'm not trying to harangue any minister, I'm not trying to blame anybody, but something is wrong, something's not working, and we all need to work very hard together to change this situation, because all I'm seeing in the 17 months that I'm here are longer and longer waiting lists, and no matter what we do, it's not getting any better.
Thank you, Deputy Murphy. Minister.
Thank you, Deputy Murphy. And as I say, I certainly will relay back exactly your representations and the points you've made here today to Deputy Rabbit, who I know is working and trying to address this and make genuine progress. In relation to nationally, in terms of our public dental health service staff of the HSE, we have 260 dentists, 60 dental hygienists and 510 dental nurses and dental surgery assistants. There has been, over the course of the pandemic, we've seen available staff reduced by 23% on an annualised basis due to staff redeployment for COVID-19 related work, such as testing, tracing and vaccination. That obviously has had impacts. But in relation to Wexford, there's currently vacant posts in dental services. So as I mentioned, the one whole-time equivalent special needs dental surgeon post, which has been sent to the National Recruitment Service in February past, and the NRS have sent this have submitted this post for to be filled, and likewise with the 0.4 part-time dental surgeon post, which again has recently last month commenced a recruitment campaign. So it's anticipated that those, when they're expedited and filled, will have an impact in relation to addressing the waiting lists that are there for dental services. In relation to Wexford itself, Deputy, the dental service there's 150 persons, 65 adults and 85 children with special needs who require dental treatment under general anaesthesia, and waiting times, as you pointed out, can range from 6 months to 36 months, and there is a small number in excess of the 36 months, which is obviously way too long, Deputy, and not acceptable. Listen, this is something that is recognised, and those two posts are being pursued in relation to having them filled, and undoubtedly it has to be a priority, because, as you outline, for all of these families and for all of these children, it's not an acceptable situation where we see.
Thank you, Minister McConnell.
Certainly, I'll relay it to Minister Rabbit for further follow-up. Thank you.